Go ahead.
Hey everyone, my name is Dr. Kenneth Rubinstein, and I'm one of the periodontists that work for Seda. First and foremost, thank you so much for taking time out of your busy schedule and watching hopefully our first of many live events that we'd like to promote to really show what dentistry is all about. Our first show tonight is going to be about dental implants.
This is not working. Hold on. Technical difficulties. It is? Oh, thank you. You see it?
There we go. First of many technical difficulties. This is our first broadcast that is live and first of many. So what I'd like to do is talk to you about dental implants.
This is wrong. Oh.
Okay. Sure. So we're filming live from our newest office in North Miami Beach. We have locations from all across South Florida, from south from Pinecrest up through Jupiter. You can visit our website at floridateeth.com. There's tons of information. Subscribe to our YouTube page. There's tons of informative videos that we're excited to share. And everything we do is going to be with live patients, no actors, and of course our awesome staff. So the first thing is let me introduce you to Natalie. She'll be handling any questions that you may have. Say hi. So if you have any questions during the performance or during our informative show here, we are going to be happy to help you and happy to answer those questions. So let's just take a walk and let's get on to it. Dr. Seda.
Hey, what's up, guys?
All right. Dr. Seda is one of our awesome dentists who can handle anything from gum disease to implants to veneers, anything messy, anything with saliva. He's your pro with tons of experience. Come on down.
See you soon.
That's May, our lovely assistant. She's going to be helping us. She's our surgical tech for the evening. She's kindly donated her services. Well, not really donated, but here in North Miami Beach, she's hanging out with us. But we got to do this quick because she's on her way to a nightclub after this. Right? Let's go, man. And then,
hey Doc,
we got Jay, who has been so grateful and allowing us to film live to do this dental implant procedure.
why not?
Why not? So a little about Jay. He's been our patient for many years. How many years, Jay?
Close to 15 years with Dr. Rubinstein and Dr. Wang.
So he's been with us for quite a while, and he's seen us evolve, and he's watched us do these informative shows. And today is kind of special because to walk you through what he needs a dental implant. And I'm going to explain to you why he needs it during the procedure. And I'm going to show you that while we do this, he's never had a dental implant procedure before. So I want to show you that A, it's not a big deal. He's going to do great. And B, that I want to dispel like all this magical, mystifying thing about what a dental implant is, because that's what everyone asks us. What is a dental implant? So I guess let's start.
Great.
Awesome. So I'm going to put him back a touch, and while I do this, like I said, I'm going to be talking to him and talking to you at the same time. Awesome. Thank you.
Just a little nervous.
You?
Oh yeah.
Well, it's
I don't know what to expect, but I trust you guys for so many years.
Okay.
That why not do it?
Well, it's better you to be nervous than me.
Right, of course.
Right?
Just watch the needle.
Nah, come on.
I'm only kidding.
So Jay has not been numbed. He hasn't had anything done yet.
Not yet.
So I really want to walk everyone through. He has no topical on, nothing.
Nothing.
This is all like, we're starting from scratch. Okay, so I want to show everybody what we're going to do.
Great.
All right? Awesome. So Jay lost a tooth. He's been losing teeth because of periodontal disease. And now's probably the best time for him in terms of replacing, because he's starting to lose a lot more teeth. So in this particular area, turn a little towards me, he basically lost that single tooth, again, as a result of gum disease. And we built up the ridge when we did the extraction. Open just a touch, buddy. Thank you. So he lost his tooth as a result of gum disease, had a huge bone defect, and we want to replace it. So we have different options. But the best option for him here is going to be to place a single tooth implant here, okay? Another option would have been a bridge, but he's got one really good tooth here that I really didn't want to destroy. So if you want to learn more about that, hit one of our other videos. But in the interim, we're doing a single tooth implant so that we don't have to touch this adjacent teeth. Remember, a single implant, it's a rod that's basically shaped like a screw. Pretend you're at Home Depot that has a surface that your bone likes. And what we do is once that implant is in, you heal for a little while, or sometimes we do it immediately, we put a tooth on top. In this particular case, we're going to put the implant in because I want to show you how easy that is. At a later date, we'll show you another video where we're going to actually put the actual tooth on that stream. Thank you. Awesome. So, unfortunately, Jay's heard a lot of bad jokes of mine in the past.
Uh-huh.
Right?
Oh, yeah.
Relax your cheeks. Awesome. A lot of shaking. Cool.
You ready?
For what?
I don't know.
Come on, nothing's gonna happen. So anyway, Jay's got plans Saturday night. Am I correct or no?
Yes, I got.
What are you doing?
Going out with my girlfriend.
Ah, see, there you go. That's awesome.
Great.
There's nothing better. See that? Awesome. Sorry about the shaking.
That's okay.
You're doing great.
Thank you.
I'm just shaking. If you feel anything, you let me know. You got me?
I got you.
Okay.
I trust you.
Okay, good. Sorry about the shaking.
That's okay.
I'm not nervous, I promise.
Okay. Good.
Awesome. More. Beautiful. You good so far?
Uh-huh.
Good. You're doing great, man.
Thank you.
I don't care what your girlfriend said about you.
Thanks a lot.
You're doing awesome. Good stuff. So Jay's been a patient of ours for about 15 years now, which is kind of cool because he's developed some trust. And really, it's a good feeling for us to have where people have been following us around, right? Thank you, man. Awesome. Don't forget, Natalie's going to answer your questions out there. If you have any questions, we'll be happy to address those. Cool. Open just a touch. Now you're going to feel, we press real hard on your palate, right?
Mm-hmm.
More bad jokes.
Okay.
Okay, and then maybe a little pinching. This is probably the worst part of the whole procedure. Okay,
Great.
buddy?
Okay.
Yeah, but you're doing great, man.
Thank you.
Thank you. You're doing great. A little pressure, and then a little bit of a stick. You good?
Mm-hmm.
Good. Take a deep breath from me. Thank you. That's it. Good. Not too bad at all, right?
Mm-mm.
Awesome.
Mm-mm.
Yeah. I actually learned how to do this technique on YouTube. Just kidding.
Thanks.
You're doing great, man. Awesome. So the key here is just to make him feel comfortable, so he doesn't feel anything, and just to walk him through this slowly, because this is actually the most difficult part of the procedure. So he's comfortable, right?
Mm-hmm.
So if you feel comfortable, it allows me to do my work better.
All right.
Okay. So when I retract Jada's cheeks, I'm going to show you the side. He's got a great ridge now because we actually built that up with a bone graft, and that takes a few months to do, right?
Mm-hmm.
And he's got tremendous ridge, which is the bone in the area. And you okay, buddy?
Mm-hmm.
Awesome. Don't forget to breathe. You're doing great. Awesome. Again, for the patient, this is the most difficult part, but I'm not going to bother him too much.
Mm-hmm.
Good. Not bad, right?
Mm-mm.
Told you. Cool. Thanks.
That's it? I didn't feel anything.
We're not going to talk about your girlfriend.
Okay.
Close that.
Thanks.
Close down a little bit. Awesome. Awesome. Want to go a little here?
Mm-hmm.
Not too bad, huh?
Mm-mm.
So basically, Jay's comfortable. That's it. Now I get to perform my magic. I'm gonna let him hang out here for a second, just to let an anesthetic take.
Wow.
Wow, good or well bad?
Oh, good.
Good.
I don't feel anything.
Good.
I didn't feel it in the palate. You told me earlier about it, the pinch.
Nothing.
Not at all.
Good.
Uh-uh. Thank you.
Of course. Awesome. Just a touch more, but he's not going to feel anything at this point. This is just really. What this does is it allows me to control the bleeding as well, even though there's very little bleeding during the implant procedure. And there's different ways to do this procedure, by the way. In this particular procedure, I'm going to show you. I'd like to show you the amount of bone that we have. There's times we do what's called a flapless technique, where I don't even elevate a flap. We don't use stitches. So there's different reasons we do different things. In this particular case, I'm going to expose it because I want to see exactly how much bone. Even though took a CT scan earlier on our up-to-date CT machine, I still want to see it and I want to feel it for sure. Okay? So that's where we are. Are you comfortable?
Very comfortable.
Awesome.
Thank you.
Awesome. Just letting you know, the only thing that may bother me is the bright yellow shirt.
Now, purposely, I didn't realize I purposely wore it. With the glasses.
Your match is perfect. You're set for my head, buddy. Okay, cool. Hey, May?
Yes.
If you could do me a favor, I'm going to ask you to retract gently. Oh,
Is it bright?
awesome. Turn a little to the left. Thank you. Got it? One second. Okay. So as you can tell, this is a very, very clean procedure with very little bleeding. Okay? So all I'm doing now is I'm going to go ahead and, like I told you earlier, just make a very small flap. Because I want to verify everything that I saw on my x-rays. Only because we like to do things a certain way. You have an itch?
Yes.
Okay. You good?
Oh, I can.
Okay, cool. So again, as you can see, it's very comfortable. And I'm just using a small instrument here to show me exactly
So it's
what
sideways.
you got. Okay? So once I elevate everything perfectly, my friend here has got a ton of new regenerated bone. Okay? And that's where we are. So just to show you, if you can see that, it may be tough to see with the type of cameras that we're using now, but my friend here's got a ton of bone. Okay? So now I'm going to go ahead and show you what we're going to do next. Hold that for a second. Let's switch around like we always do. I'm going to steal my mirror. Thank you. Excellent. Now, there's tons of different types of dental implant. Okay? We like to use, just like we use the best technology here with CT scans, different types of digital x-rays, okay? In this particular case, we're going to use a certain implant system, which I'm going to talk about a little while later. Dr. Maseda, do you have any questions? You good?
I don't have any questions so far.
Okay, good. Good. Your light check?
Alright.
Okay. You want to itch? You're good.
Alright.
Cool. I'm just going to put this here. So now this is a little bit of water, okay? You're going to be just fine.
1 second, I'm sorry.
Take your time. You're good.
I think to my eye.
No, you're good.
All right.
Good?
Yes.
Awesome. So a lot of water just for a second here. Turn a little to the left. I'm going to try and demonstrate this to the best of our abilities so that everyone can see. I'm going to hold that like so. Okay? And we're going to push the implant in like that. Okay? So what we're doing here is we're going to follow exactly where the roots are. Okay? And we look and we're going for solid bone. Excellent. Thank you.
Play a little torch here.
Good.
I like your glasses.
That's right.
How do you think? Fine? Right.
Jay, you good?
Okay.
Awesome. Do 10 seconds here.
Okay.
He's a great patient.
Got it. Got it. Beautiful. Okay, cool. Little technical difficulty. Sorry about that, guys. Okay, so things do happen. We're good to go.
So what are we doing?
We're going to do the guide hole, which is where we left off. It just shows me exactly where the implant is going to go. And we're looking great. Cool. Okay, so that's going to show me exactly. So usually we're sitting down, but I want to show everybody. Great. So that's how it looks. Then we're drilling into the bone. Awesome. Okay, you comfortable?
Yeah.
Awesome. Okay. So what I'd like to do now is we're going to put a guide pin in, and that shows you pretty much where the implant's going to go. Okay, you can see, as you can see, that's exactly where it's supposed to be in terms of straight cross-section. Don't bite down. We're going to take a quick X-ray. Awesome. May, if you could do me a favor, take one X-ray. I'd appreciate it.
Perfect.
Thank you, thank you. So now we're going to take a digital X-ray. Gotta protect my cameraman. Come on out, Jim. So right now we're going to be taking an X-ray. That's going to show me exactly the angulation. And then if that looks good, we're going to proceed to the next couple drills, and we're going to put the implant in. We're done. We're almost there. Almost there. So we had a technical difficulty with the water. I like a certain amount of water that comes out from the implant motor. Didn't come out. Things happen, right? When you're filming live, you never know. Now I know how Al Roker feels when he's doing the weather. It's not easy. Oprah. I don't know how they do it. God. The Kardashians.
I didn't feel nothing at all. Even that pinch, that needle.
Awesome.
I'll tell you something. I trust you guys for over 15 years.
That's
You
awesome.
guys are, seriously, you and Dr. Wayne, with the whole staff, it's phenomenal.
Thank you. I appreciate
No,
that.
I mean, it's from the bottom of my heart.
Thank you. I appreciate
You
that.
guys are great.
It's awesome.
Very
Smile. Smile for the X-ray.
Thanks.
Just one second, okay?
Good. Take a look. I love it. Take a look. Jim, come on over. Awesome. So take a look. Okay, the digital X-ray is up on the screen. It's exactly where we should be. Okay? We corrected in terms of positioning later, but the implant is exactly, the position in the air is exactly where it's supposed to be. So let's move to the next step.
Can you take that suction out?
Yeah, of course. I got you. I'm gonna put you back to the same position as you were before.
Yeah, go ahead.
Yeah, I got you. Okay, we'll see you soon. Thank you. We're good to go. Open a touch. Close like a straw. Awesome. Thank you. Thank you. Good. Next step. Excellent. Turn a little to the left, please. Thank you. Great. Hold that for a second. I'll get you your suction. Here's your weapon. All ready to go. Part 2. So now we're going to do the exact same thing. All we're doing is slightly larger diameter burrs. Same amount of water. And just really increasing the space to allow us to screw that implant in. Right here. Doing great. And this is the last one, and then we're pretty much done. Smooth sailing. Great. Okay, cool. Awesome. So that's pretty much as far as drilling, and as far as the next part is concerned, we're going to go ahead and put our implant
Are you
in.
open? Open your mouth.
So this is our implant. And as I stated previously, we only use the best of the best. And in this case, we're using what we call a Straumann dental implant. And they are awesome. You should be asking your dentist, even if it's not us, that's totally cool. You should be asking your dentist, hey, what kind of implant are you going to be placing in there? Because there's reasons why they can lower the price or escalate prices. We're using real materials. This is like the best stuff money can buy, and we stand by our work, so there's a reason why we use these materials. So just a touch thing. So you can see, this is what we do slowly. We go ahead and pretty much drill the implant in place. Just hold it right there. You're doing great. Say, how you doing? Awesome. And that's pretty much the implant procedure right now. The procedure itself shouldn't take more than, I don't know, we're doing it all day long, so it takes about 10 minutes. It took a little while longer today because of the difficulty that we had with the water. No big deal. And he's well on his way to getting a crown. So, now we put what we call a healing cap in place. Which covers the implant. And that's going to be almost flush with his gums. And that's going to sit there until it heals. How long is this going to heal? It's going to be without that tooth for about 6 to 8 weeks, because again, we use that special type of implant that heals real quickly. Okay, and that implant is exactly where it's supposed to be. Let's grab it. Thank you. And they're going to go home with 2 stitches that dissolve by themselves. Excellent. Just a touch it. Thank you. So there's a lot to it, not just placing an implant, because we look at soft tissue. There's a lot of things that we look at here in terms of how to place the implant correctly. And that's pretty much why you want to go to a professional who knows what they're doing and does a lot of them. Okay? And this is pretty much the entire procedure. May, it's all yours. Hold on. That's one. Cool. And let's go to the other foot. So we're going to give him some post-op instructions, which means instructions for afterwards. Once we take the final x-ray, we get to make sure he's doing all right. Are you doing all right, Jay? Mm-hmm. Awesome. That's for you. Good. Just a little pressure. And as you can see, there's really no bleeding at all. This is not. And I anticipate this to be pretty easy and nothing in terms of post-operative healing. Nothing, you won't need anything more than a Motrin. How you doing?
Great.
That's it, we're done.
Yeah.
Wow.
Unbelievable.
Yeah, he was here for a vasectomy.
Thanks, Doc.
Oh, wow. That's
So,
it.
one more x-ray and
Yeah, one more x-ray, we're done.
Okay.
You okay?
Yes.
Surprised? Not surprised?
Surprised.
What do you think?
Wow, great.
Okay, cool. Would you do it again?
Yes, I would.
Okay.
Eventually, I'm gonna do it again. You know that. I have to do it again.
Let's take that one X-ray. Let's
Great, thank you.
call it a show. So that's pretty much it. That's a dental implant. Hope you enjoyed it. I'll give you a final look at the final X-ray, but you can see what you do about nothing. Straight start to finish, 15 minutes. Hope you enjoyed it. Check out our YouTube channel, subscribe. You can watch us over and over again. Check out our other videos, they're all informative. This is how we have a good time. Our team is awesome at Seda Dental. Hopefully you visit.
Yeah.
Yeah, you're numb, Jay.
Okay, fine. Perfect.
Awesome. Don't trip, please.
Not live.
Yeah, not live.
Okay, don't move.
Awesome. Great, and that's where we are. Singles with implant. It's exactly what it's supposed to be.
Wow.
We're ready to go. Awesome.
Thank you.
With this awesome surface, it's gonna be about 8 weeks, 6 weeks of healing, and I'll have a tooth in no time. Cool. Jay, you good?
Perfect.
Great.
It felt absolutely zero.
Awesome. Again, thanks for tuning in. Have a great night, and we hope to see you again at our next show. And we'll take suggestions if you guys want. If there's certain things you want to hear about, we'll be happy to promote those at our next and talk about those things next. Thanks.